Hey, how you doing, Mark?
I'm doing all right. So orthopedic surgery. Now, before we get into what you do over there at Vassar Brothers Medical Center, let's talk real quickly about this basketball player and his compound fracture that happened a couple weeks ago that snapped his leg right. I mean, that's not an orthopedic procedure, first of all, is it?
Oh, that absolutely is an orthopedic procedure.
Oh, it is. It's not a, well, I'm just thinking joints for some reason.
Yeah,
but.
no, we take care of fractures, sprains, any musculoskeletal problem. Mm-hmm. But that was a very unusual injury. You think about how many professional college, high school basketball players, high-impact athletes doing the same thing, and I've never heard of something like this happen. The Joe Theismann incident back in the 80s.
Yeah, he was hit by somebody.
He was hit by Lawrence Taylor, which was like a truck hitting him. This guy just went up for a jump and he misstepped.
Yeah.
So no one said it, but there must be something else going on. Possibly he had a benign lesion in the bone that made a weak spot.
That's true. Yeah.
But for that compound or open fracture to happen from a jump like that is very unusual.
What kind of weird stuff would happen to folks that you've seen?
Sometimes even from misstepping, if the force goes through the joint the wrong way, it could cause the bone to dislocate out of the socket and rip through the skin.
Oh, thanks a lot. We're done here.
Good thing there's no images on radio, right?
Yeah. Well, just thinking of that. So you see that happens every now and then.
It does every once in a while, and just depending on the type of fracture, if the pointy end of the bone is pointing the wrong way, it could tear through the skin and cause a similar kind of injury to that basketball player.
Something weird that seems, is it me or are younger and younger people needing hip and knee replacement stuff now? This is something you used to think was old people that this happened to.
It's very interesting. Back when I was in medical school and my training, God, it's almost 20 years now, typically if you weren't a certain age, you would be put off until you got older to have these joint replacements done, with the concern that they would wear out and you'd have to have them redone in a relatively short time. And back then, before the technology was really refined, that revision surgery, the redo surgery, could be very difficult, even catastrophic sometimes. Nowadays, doing the revision is not a big deal. So we have lowered the bar to do people younger and younger, whether hip or knee or even shoulder replacement surgery. Mm-hmm. And with people being as active as they are, that might be part of it too, that people are just wearing their joints out quicker because they're so active now.
Are there a lot of knee and hip replacements here in the area being done? Is that, you guys do a lot of that stuff at Vassar Brothers?
There's an enormous amount. I do quite a few every single week. Historically, I came to the area in the mid-'90s. There was a lot of out-migration to New York City or even Albany. Mm-hmm. And year after year, most people do stay here because we do quality work, and it's comparable or better than the large, massive institutions of the city.
What happened to me was you have some pain and you think you can be a man and play through it, and that's the worst thing somebody could do, right?
Yep. Denial is normal, and it happens to everyone. And if you think something's wrong, the problem is you're going to be living in pain and restricting what you want to do. And the other thing is you're putting yourself at risk. Having a torn cartilage or having some kind of a problem could cause you to fall and cause you to cause more damage to the joint than if you just sought treatment when you were having the problem itself.
All right. Thanks, David. We appreciate you coming in.
Great. Thank you, Mark.